For about 9 years. Started out at Texas Tech PD as an LVN. Been working at BSA on cardiology for about 6 years and now work at Vibra Hospital in the ICU, which is a lot more fun because most of the patients are asleep, so get a lot of reading done. Psychotropic medication. This is a PowerPoint that the state has put out, and I'm just going to go over it with you guys. The medications on here, the first half is a lot about medical consenter. It talks about the red tape of reviewing medications and making sure the child is on the right med, and some peer reviews that come up that the state automatically triggers when a child's on more than one type of medication. Just some slides here. Let's see here. Jackpot. Everybody wants to get all those medications. So this training was, like I said, put out for the children in Texas foster care. It's the training explains the state expectations for safe and effective use of the psychotropic medications. Texas Department of Family and Protective Services there, the DFPS. This training is it's going to help, let's see here. You have to forgive me, it's been a couple of years since I spoke to a large group, and I work nights now, so I'm usually asleep at this time. But this will help talk about the conservatorship, medical consenters, and some specific questions and materials that might help you along the way. Looks like there was a couple of slides Lee loved to put in there. I have no idea about them. Let's see. Alter your brain. Psychodrugs can alter your brain. What is psychotropic medications? These are the medications that we prescribe, or the doctors prescribe, to help a person with their mental, emotional, or behavioral disorders. This could be for depression, this could be for post-traumatic stress disorder from someone who was severely abused. A lot of these medications, you'll have to keep in mind that they don't really know how these medications will affect the body as it grows. The medications work on a person may not be the same as it will work on another one. So these medications will also influence a child's behavior. It modifies it. Hopefully it'll affect their cognitive behavior if they're having some problems with ADHD and whatnot. Some of these medications, what are these meds? They have them listed over there: psychomotor stimulants, antidepressants, antipsychotics, agents to control mania or depression, anxiety, sedatives, hypnotics. Lots of fun meds. Help for information and definitions. Caregiver means a foster parent, a relative, or a kinship placement. Residential provider means a child placing in an agency, a residential operation of their staff. Medical consenter is a person named by the court or DFPS to make the medical decisions. And I'm sure you know all about that. Star Health is the health plan that most of the children are on while in this conservatorship. And conservatorship means the child is in the legal custody of the state of Texas, DFPS. Purpose of the training is to help to educate you, foster parents, residential providers about psychotropic medications, help you make informed decisions on which meds may be right for the child. It's to help you monitor the child for side effects on these prescribed meds. These medications are very dangerous. They're very serious. A lot of these medications came about after the 1990s. Some of the first medications were back in the 1950s, like lithium. And since the 1990s, it really skyrocketed there with a lot of meds. But they have a lot of dangerous side effects that can actually kill you. Goals and objectives is to understand that other interventions should be considered along with psychotropic medications. They don't want to automatically just throw a child on a med. They want to try other things with therapy and such like that, so that we don't have to put extra chemicals in the body. If we can get around not having to use a pill, that would be the best thing. But sometimes that's what we'll be doing as a last resort. And the main reason for that is, again, we don't know how this medication will affect the body as the child grows. Some of these medications can do things like stunt the child's growth, give them tics and triggers that they will carry for the rest of their life if not noticed in time, such as the tardive dyskinesia we'll talk about later. Goals and objectives: to understand the need for a complete psychiatric evaluation, maybe including that of a physical exam. Some of these medications with the physical exam would include like an EKG and blood monitoring, because some of these meds will affect the heart. Understanding the responsibility of the medical consenter to decide whether or not to give an informed consent. Understand how psychotropic medications are used. Understand how to monitor the child for possible side effects. We will go into side effects, and it's just briefly. We talk about a generalization, not about each individual med. Best thing to do is to read the little insert that you get from the pharmacy. Know what to do if you have concerns about a psychotropic med prescribed to the child. Know about the psychotropic medications utilization parameters for for the children in foster care, and be aware of various classes of psychotropic medications, how they work, their side effects, and examples of the medications. So we'll go through all of that. The first module, I think it's broken down into 3 different modules. The first module is decision about consenting in psychotropic or psychiatric evaluation. All right, so legislative requirements for medical consent training. Medical consenters are required by Texas law to receive training on informed consent, the non-pharmacological interventions that can be done, meaning non-medication. This information is covered in the DFPS medical consenting training. What is the medical consenter? And I know I overheard you guys already talking about a lot of this stuff that we'll be going over. Medical consenter is a person who has been given legal authority by DFPS or by the court to make health care decisions for a child in custody. This means that person will decide whether or not to consent to medical, dental, eye, or behavioral health care for the child, which would include medications. Use of psychotropic medications. Most children in conservatorship never need psychotropic medications, but the children who are traumatized, abused, neglect, separations, may show some negative behavior, signs of emotional stress. These things, they will try the non-pharmacological routes, and if that doesn't work, then sometimes they do have to go on those meds. Gives an example for 2-year-olds commonly temper tantrums, and teenagers are commonly rebelling. Those are not needs for medications. Although you do want to sedate a teenager when he starts yelling at you, I can understand that. Use of psychotropic medications, sometimes, support from the caregiver's knowledge of a trauma-informed care can help for the child. Being there for the child, this is here they kind of talk about coping, how the child may need to cope for being separated from their home, or how to cope with the trauma and abuse. They kind of encourage you to just try to be there, be patient with the child, try to go through the motions without going to the psychotropic medications. Sometimes just a caregiver who can help heal the child with their experiences with love and understanding is all that the child may need, and that would be the best. Importance of an appropriate environment. Most children will heal with stability and consistency. It's that consistency that we really need to focus on. This means that the child does not change placements and caregivers. Okay, so some good qualities, being patient, understanding, and kind, loving and gentle with the child. Give clear instructions on what expectations of the house rules can help the child adjust better to the setting. They suggest that doing this will teach the child coping skills, how to control their behaviors and emotions. Praising the child for positive behaviors will hopefully prevent them from trying to get negative attention and help them seek after the positive ones. Make sure the consequences given when a rule is broken is always consistent for each child, even though each child will be breaking those rules differently. The importance of an appropriate environment. Children may act out as they adjust to a new home. I'm sure you guys are familiar with that. And learning of the new rules. Caregivers should expect that the adjustment, Okay, caregivers should expect that the adjustment takes time and to give appropriate support and acceptance. If given safe and positive nurturing, consistent trauma-informed care, most children will learn to trust and feel safe in your care. There are different stages of healing and adjusting, and just be aware of them. Some children will take a lot longer to develop that bond with you than others, and I'm sure if you've been doing this, you've already are aware of that. Some of the non-pharmacological interventions that they suggest, specific methods that the caregiver can use to help with the child behavior may include therapy, specific therapy modification strategies. They will sometimes have a group therapy. They may include a family therapy so that discussions may be made to help everyone be on the same page and to adjusting towards the goal at hand. There's the individual therapies, the group therapies. Sometimes talking to the child's caseworker or CPA staff with the treatment team. I don't know if you guys use treatment teams here. Helps. It really helps to if you're having treatment teams for the parents to get together with the treatment team to talk about different strategies you've been using for the child One strategy in your house may help the strategy determined for the next, help with the next household. All right, seek medical help. If a child has serious symptoms, is not getting better with the non-pharmacological interventions, then we need to go ahead and consider seeking medical help. Anytime a child is in danger to himself or others, you need to immediately contact the doctor, take them to the ER. If they are suicidal or having suicidal ideations, your facility may possibly have already covered the program. Ouch. On a policy on how to deal with that. A child and adolescent psychiatrist will do a complete psychiatric evaluation on the child to make recommendations about treatment. The child's primary provider, if you are not sure if the child needs to see a psychiatrist, can talk to you about whether a psychiatrist would be beneficial. Complete psychiatric evaluation, what it is. This is where the psychiatrist will talk to the child. He'll talk to the caregivers or the medical consenters, trying to review things that are going on with the child, concerns. He'll review the medical history, may need to do some labs, some EKGs. They'll do a psychosocial evaluation, which is a mental evaluation, and it may involve some testing done by psychologists. Educational assessments to help find out the child's ability to learn, such as, if he has any learning disabilities such as dyslexia, sensory processing, autism. Speech and language evaluations are also usually beneficial at this time to try to see whether or not the child is going to be able to understand the words you're using. You think you're using the appropriate words for a fifth grader to understand, but they may be on the level of a third grader and can't understand what's going on, what you're talking to them about. So that's when the doctor will do the speech and language evaluation. During the evaluation, they will give a diagnosis and best recommendations to treat the child. What the psychiatrist will need to know to get this job done is a description of the child's problems, his health, illness, and treatment, both physical and mentally, including current medications. I'm sure you guys have a list of medications. You'll need to also make sure anything over the counter that is being taken by the child is also brought to the doctor's attention. These things can interfere with the medication the doctor may prescribe. Antacids may not allow the child to absorb the medication. So if they're taking like Mylanta, you'll probably have to give the Mylanta and then wait for 2 hours to give the child's med. Otherwise, the Mylanta may interfere with the absorption of the medication. The child doesn't get the Seroquel that they're on. Sometimes milk products will help coat the stomach, and by doing so, it'll if the medication is absorbed in the stomach or the GI tract, they will not be able to absorb that medication because it's being coated by the milk. So all these over-the-counter medications and all that stuff, of course, you have to bring with you to the appointments. Information about the school and friends, information you may have on the child's development. They have are you guys familiar with the passport for the child's health? They have a passport for Texas Online that's going to be able to have the medical consenters to log in and can see doctor's visits, what the child's been prescribed, child's medical history, so the doctor will hopefully be able to go online, and if the child's being switched from care to care, home to home, a lot of times these things get lost. They don't know whether, dental x-rays were done at the last home, so the dentist will try to do another set of x-rays, and If they log on, they can see that, no, he's not due for the x-rays. They were already done, and they were done at this dental office, and we can go ahead and call them up and get those x-rays. So it's very helpful. And actually, that's going to be talked about here in a little bit. But all these things are also very, very helpful for the doctor to make an appropriate evaluation. And that last little bolded letter, it's important for the child's caregiver or medical consignor to find out as much possible about the child before taking them to the psychiatrist. The psychiatrist needs to know how the child is doing in all areas of his or her life. Diagnosis of mental disorders. It's a little different from my slide. Looks like a lot of people with headaches up there. Before prescribing a psychotropic medication, the psychiatrist will give the child a diagnosis, and this diagnosis is going to come out of the DSM, the Diagnostic and Statistical Manual of Mental Disorders, which changes every so often. I think they got a new version coming out if it's not already out, but since then it hadn't changed in the past 10 years. Diagnosis of the mental disorders. If the caregiver or the medical consignor needs help to understand the diagnosis, make sure you talk to the doctor. Make sure if you're wanting more information, you can always go online. You can always ask the doctor for specific educational materials they should have there at the office to help you understand. It's good to know what the diagnosis is, what it entails, so that you kind of know how to treat or react with the child, and gives you an idea of how the behaviors of the child are going to be played out in your home. Psychiatrist recommendations. They may recommend therapy. They may recommend medications. The medical consignor should be diligent while working with the medical provider to get answers to the questions about therapy, to find out as much as they can on the treatments, to determine what treatment is the best in the best interest of the child. Don't be afraid to ask questions. Ask the doctor questions about medications or therapy. A lot of times the doctor may put a child on a medication, and it may take a couple of weeks before the medication gets in their system enough to take effect. So it's good to know if the doctor's going to start them on a new med, how long it's going to take before you start seeing a difference, what you should be watching for. Making a decision about psychotropic medications. This means the doctor, let's see here, informed consent. The psychiatrist must obtain the informed consent from you before prescribing the psychotropic medication. This means the doctor must give the medical consignor enough information to decide whether or not this medication is going to work for the child, if it's something that you will be in agreement to try on the child, to make sure it's in the child's best interest. The process of understanding the risks and benefits of giving the medications to the child is a vital part of the informed consent. What does undue influence mean? It's where undue influence means that the medical consignor is deciding based on what is best for the child and not because of the pressure to consent to a medication for treatment that the doctor may feel is in the best interest of the child. You should feel guilt-free when you make the decision. You should not feel like you're being pressured to start a child on a new med. And again, according to the Texas law, your consent to giving a psychotropic medication is valid only if it is given voluntarily without undue influence. The consignor receives information given either verbally or in writing. Needs to contain specific information on treatment, the beneficial effects of the treatment, probable health and mental health consequences of consenting to the medication, clinical significant side effects and risks associated with the medication, and generally accepting alternative medications that may also be out there that are non-pharmacological. After the doctor has prescribed some medication require you to come in every 30 days. Some medication may require you to come back every 90 days. Texas law requires you to follow up on those medications every 90 days at least, either with a advanced practice nurse or with a PA, if not the physician. And the reason why is that some of these medications, like I say, do cause life-threatening illnesses, life-changing side effects. Some of these medications have to be in a therapeutic range. If they're not, they'll draw the blood work. For some of them, like lithium, you have to be between two certain goals. If you're not at that point in your blood where the lithium's at the goal, it's not doing them any good. If it's too high, it could kill them. So it's good to follow up and to keep those appointments. Continuing on informed consents, what does it involve? Some things the medical consenter should discuss with the doctor is, what's the child's diagnosis and the symptoms? Will the psychotropic medication help the child? How does it help the child? Does the medication have risk? Are there alternatives, such as interventions that do not require med? While they're at the office, be sure to ask the doctor different questions about the medication that may be prescribed, such as the name of the med, other names, such as generic names and other off-brand names that the doctor may have the child on these meds. Some of these meds the doctor may put the child on. They may not be using it for the actual medication. They have different meds that they use for what they call off-label uses, such as Flomax is an off-label use. For Flomax is to help open up the uterus for kidney stones to pass. It's not just for prostate. And sometimes the doctor will prescribe Flomax to a female who doesn't have a prostate, and they're kind of confused about that. That would be a good reason to ask, why am I taking Flomax? So the doctor may prescribe the child medication for something that is not actually in use of the medication that you know little about. And so it's always good to be informed. There they talk about the off-label use. Other questions on asking the doctor, finding out recommended dosage helps. It's very important to know what type of follow-ups on these medications you're going to need to do, such as the laboratory testing, the EKGs. Some of these medications can cause congestive heart failure, can cause an atopic rhythm for the heart. So the EKGs are needed every 6 months, and a baseline EKG before they start. Grapefruit juice can, is that listed on there? Yeah, certain foods, when you're taking medications, interact with certain meds like MAOIs. You cannot eat cheeses or chocolate or any drink wine, which hopefully the children won't be drinking, or beer, because they have a certain enzyme in it that interact with the medication. So certain foods interact. Grapefruit will interact with a lot of meds that are out there on the market, not allowing the med to be absorbed. So it's good to ask the doctor if there's certain foods that you need to avoid while taking these meds. And talk to the kids about the medications. Tell them, in language they can understand why they're taking the med, what you're hoping to accomplish with this medication. Ask them their thoughts on the medication. Ask them if there's specific traits or behaviors that they may be noticing about themselves that they want to talk to the doctor about and see about interventions that may come along. Why to talk to the child about these psychotropic medication? It helps the child feel more controlled, builds a trust between you and the child and the doctor to help ensure treatment success. Children learn to make medical decisions as adults as they grow up. I think at the age of 16, 17, they can ask to become, the court may allow the child at 16 or 17 to allow the child to consent to his or her own medical care. So, it's helpful to talk to them about these medicines so that you got it in their mind on what's best for them so that they can make more informed decisions as they grow older themselves. Duties for the attorney ad litem. Texas law requires attorneys ad litem to advise a youth who are 16 years of age or older their right to ask the court to authorize the youth to be his own medical consenter. The youth must take the DFPS approved medical consent training, just as you guys must, and the youth must still provide medical information to the CPS caseworker and is expected to make the medical decisions in his or her best interest. So they can't just be completely on their own. They must keep the CPS and you guys up to date on what's going on in the medical treatment. After all, they're living with you. Transitional Living Services Programs requirements. DFPS must ensure that the youth transition plan includes provision to assist the youth in safe managing medication usage after exiting foster care and include information that educates the youth about the use of the meds, resources available to assist the youth in safely managing his or her meds, and informed consent and their right of the youth to be his or her own medical consenter. And that is the end of Module 1. And then we have another module here that's just as equally dry, so you'll have to forgive me. This one is giving psychotropic medication and monitoring and following up. Okay, so remember that psychotropic medications are only one strategy to help the child. We should try to try other interventions prior to going into a med. The child may need other interventions along with these medications to help them get the best out of it. They may need to go into behavioral health therapies, cognitive modifications. Always read and keep the insert from the pharmacy on these medications. The insert tells you important information on how to give the medication. Sometimes the doctor will just give you the med and forget to tell you about the medication, so these inserts help a lot. Store the medication in the original container that came from the pharmacy. That way you don't get confused on what med is in what Give the medication exactly how it is prescribed. Never quit a medication that you're giving to a child unless the doctor tells you to. Sometimes most of these medications require a weaning period. It takes time to build up in their system, and it'll take time to come out of their system. Antidepressants, as they start taking those, they're more at risk for suicide ideation and may completely go into the point where they actually have a plan and complete the plan and kill themselves while they're starting on an antidepressant, and it's the same thing happens when they're coming off the antidepressant. So never want to just stop abruptly on a med. You want to follow the doctor's directions on giving the medication. It may be that the child should have the medication at a certain time of the day. You don't want to give the child a medication that's going to keep them up all night. It's bad for you and it's bad for the child. You'll want to give stimulants like first thing in the morning, and you usually don't want to give them after 12 o'clock noon, because it will affect the time that the child goes to bed. Watch to make sure the child takes medication. Never give a child a medication that is prescribed to someone else. Just because you see Johnny acting the same as Susie doesn't mean they have the same thing going on and will be benefited by the same medication. Keep the medication log. I'm sure no one would actually do that. But keep the medication log, write down the time of the day. Coordinate with the doctor to make sure that you get refills on time. Again, you don't want to stop a medication abruptly always, so make sure you have the refills so they don't miss doses. Side effects. Side effects are not an allergic reaction to the medication. They are a side effect from the med. A allergic reaction is something totally different. Side effects may be from anything from drowsiness, headaches, stomach aches, sleep problems. This may start with a medication and may happen again when increasing the dose of a medication, but usually these side effects go away within the first week. Sometimes it'll go away quicker for other individuals, maybe just a day or two, but just because these side effects are going on is no need to worry about stopping the medication. If it does persist past the week, that would be something to call the doctor on and ask them about maybe switching to a different type of med. An adverse reaction, it would be an allergic reaction to the medication. It's something that's uncommon. It's not expected. It's likely to harm the child if they keep taking the medication. It's a life-threatening condition. This is like the child takes the med, they break out in hives. The child takes the med, they start to gasp and hold their throat because their throat's swelling up and they can't breathe. That would be an anaphylactic attack, and that is, of course, an emergency. You'll want to get them to the ER immediately. Immediately talk to your doctor about his or her directions if there is any adverse reaction to the medication. So if you're noticing anything, they want you to immediately call. Okay. Always report adverse reactions to the doctor right away. Call 911 if needed immediately. Remember to report the information to CPS, the child placing agency. If there is any problems with taking a certain med that the doctor has prescribed. Monitoring and following up on the medication. Of course, you'll want to watch for side effects and adverse reaction and report them to the doctor. Watch for any changes in the child's behaviors to see if the symptoms that may show whether the medication is working or not. Some medications may make the symptoms that you're trying to prevent worse. So keep an eye on them. Write down in the child's record any side effects, changes in behavior, or contacts with the doctor on his or her office about the medication. You want to keep a log of it so that someone else who may be coming behind you understands that you've already addressed the situation. Take the child to the doctor or healthcare professional who prescribed the medication at least every 90 days so the doctor can evaluate how the child is doing on the med. Attend each visit with the child and the prescribing doctor so that everybody is on the same page. Report side effects at the time to the doctor. Of course, the reverse reactions, you'll probably want to call the doctor and not wait to the next visit. Let's see. And how the child is doing on the medication to the child's CPS caseworker to keep them informed. I'm not for sure how that works. I'm sure you guys are more familiar with that than I am. Things to talk to the doctor about during the follow-up visits, changes in the behavior, whether they're getting better or worse, the moods, their appetite, if it's affecting their sleep. Usually when they put them on a new medicine, they will usually ask to see you back in the office in 2 to 3 weeks, if not just the next week, so that they know whether the medication is working for the child. Changes in how the child gets along with others. If you're suspecting the child may be doing drugs or alcohol, you'll always want to make sure the doctor's aware of it. Certain medications will be worsen the side effects if they're on drugs or alcohol, of course. Some medications cause weight gain, some may cause weight loss. Stimulants for the child's ADHD may cause growth retardation and the child doesn't grow. They actually become a failure to thrive because they're not putting on any weight, and it affects their bone density. They can break bones easier that way. So stuff like that, bring to the doctor's attention so that they can arrange the appropriate tests to make sure the child's health is at its best. Okay, the psychotropic medication utilization parameters for foster children. These are parameters that give general principles for the doctors who prescribe these medications on let's see here. This is a parameter. These parameters were developed by a group of experts in child adolescent psychologists, pediatricians, pharmacologists, and other mental health experts, and they are updated regularly. These parameters, they are based on reliable research and has the best interest of treating the child at mind. They list 9 criteria that point out the need to review a child's psychotropic medication that was prescribed to the child. And there is the website if you would like to go visit it online. PMUR there is the process that Star Health uses to screen for the child's psychotropic medications and review them when they fall outside the parameters. Being outside the parameters does not mean that the psychotropic medication is harmful for the child. Rather, being outside the parameters means that the Star Health child and adolescent psychiatrists need to review the case to see how the child is doing to make sure the right treatment is being used for the child. The parameters here, such as all children under the age of 4, any child taking medication that is like 2 or more stimulants, 2 or more alpha and agonists, that would be like alpha agonist would be like Klonopin. It's normally used for blood pressure in the hospitals, but they give it in low doses to children to kind of sedate them. Drug users uses Klonopin also because they like that sedative effect of Klonopin to help slow them down, to keep them from going 100 miles an hour with their little motors in their head. If they're on 2 or more antidepressants, 2 or more atypical antipsychotics, or 3 or more mood stabilizer. You'll see a lot of patients or a lot of kids who have mood disorders, bipolar disorder, who will be on several medications such as antipsychotics. They may be on an antidepressant, and they may be on mood stabilizers to help treat all their signs and symptoms. If they're on too many of them, we worry about polypharmacy, where the child may end up having more harm than good that goes on, and so this is why the parameters came about. If an antipsychotic medication is prescribed continuously, appropriate monitoring of blood glucose and lipids at every 6 months is required. Antipsychotics does work on the pancreas and it does work on the liver. It can cause pancreatic cancer. It can cause liver failure. So these are some of the things that they want the doctors to follow up on and why the parameters were set into place. What triggers a PMUR? It can happen in several different ways. It's an automated process that the pharmacy information that identifies when children's medications are outside the parameters, when the STAR Health Service managers or coordinators call the caregiver and medical consenters to do a screening on the child who are newly placed and have changed placements that result in warrants of a review. When someone such as the caregiver, medical consenter, attorney, CASA, residential provider, or other persons have a concern and ask Star Health for a review, that can trigger the PMUR to take place. The court may ask for a review. What happens during the review when the child's psychotropic medications fall outside the parameters, the Star Health child and the adolescent psychiatrist reviews the child's medical information, talks to the doctor who prescribed the medication. Sometimes the medications are changed. Other time the child is kept on the medications. Even though the medications are outside the parameters, just being outside the parameters, like I said earlier, doesn't mean that there's something wrong. It just means that it needs to be reviewed to make sure the child's health is at heart, the best interest of the child is at heart here. The Star Health psychiatrist will consult with prescribing clinicians, again within 60 to 90 days, if the medication regimen remains outside the parameters. And then it gives you a link to go on and request it if you want to, a link or a number. The health passport I talked about a little bit earlier. This links the patient's information on a leaflet of medications that are useful tools for the health passport and medication dose and usage. It's a web-based system. It keeps track of all the medical information that are going on with the children, inclusive prescriptions, diagnosis. If the doctor wants to put in progress notes or a therapist wants to go in and put in notes on the child after sessions, they can do that, and they can be reviewed by you or the child or the medical consenter by going online and looking at the health passport. I think it is a mandatory thing that all children in Texas are having to do. It's not a federal, it's a state requirement. I'm not for sure if it's already in effect as a mandatory thing, but I know that it's already up and going. Is it okay for my child to take medication that does not have an FDA approval? Medications used to treat young people with mental illness are safe and effective. Psychotropic medications, however, do not have federal FDA approval label for use. Like I was saying, that off-labeled use, the doctor may want to try to give a antipsychotic to try to help with a certain mood. It may not be may not be intentionally prescribed. Well, actually, like an anti-seizure drug may not be